Hello, everyone. My name is Amber Mendoza, and this presentation will go over the highlights of my final paper titled Understanding the Perceptions of Barriers and Promoters of Physical Activity among Hispanic Adolescents ages 12 to 18 in Santa Maria, California. My topic of interest is prediabetes. Prediabetes is defined as a health condition where blood sugar levels are elevated past a normal state, but have not reached stages indicating a diagnosis for diabetes. Prediabetes plays a pivotal role in prognosis and is a practical indicator of future development of diabetes. Diabetes is a chronic disease affecting more than 37 million, or 11%, of people in the United States, plaguing the nation with increased morbidity, mortality, and costly healthcare expenditure. Unfortunately, prediabetes is rapidly presenting in younger aged individuals, with the latest research indicating that 1 in every 5 adolescents ages 12 to 18 currently live with a diagnosis. This prevalence of prediabetes in the pediatric population has drastically increased within the last few decades, indicating rates were once at 11.6% in 1999 to now a staggering 28.2% in 2018. Hispanic adolescents are disproportionately impacted and have a higher predisposition to prediabetes and diabetes compared to non-Hispanic populations. National numbers for diabetes are reflective to California data. According to the American Diabetes Association, over 33% of Californian adults have prediabetes. An estimated 3.2 million, or 10.5% of California adults have a diagnosis of diabetes, and over 800,000 people unknowingly have diabetes. Diabetes disproportionately impacts Hispanics, with 11.8% of Hispanics having a diagnosis of diabetes compared to 7.4% of non-Hispanic whites. The estimated cost of diagnosed diabetes in California is $39.5 billion. Santa Maria is a city in Santa Barbara County in California. Although there is no statistical data for prediabetes for adolescents in Santa Maria, the city has a dense population of Hispanics, with 77% of individuals identifying as Hispanic. As aforementioned, the Hispanic population is at an unequal predisposition to developing diabetes. Diabetes findings in the 2019 Santa Barbara County Community Health Needs Assessment revealed the Hispanic demographic is the most impacted by diabetes, with 9.4% of Hispanic adults having a diagnosis of diabetes versus 6.9% in non-Hispanic whites. With 77% of individuals in Santa Maria identifying as Hispanic, it is no surprise that 96% of students at Santa Maria High School identified as Hispanic. Santa Maria High School is a setting where the target population for the proposed study can be found, and is a great place to be able to identify some of these demographics. Data indicates these students have lower reading levels and are economically disadvantaged, both of which are tied to lower health outcomes. For this reason, it can be inferred that prediabetes is present and in higher magnitudes in Santa Maria adolescents. Prediabetes in early childhood elevates risk for concomitant complications of the disease and untimely deaths in adulthood. Prompt and effective public health interventions are essential to prevent surges of prediabetes in the pediatric population, or at minimum, prevent the progression to diabetes. Regular physical activity is a health behavior that can reduce risk of developing diabetes. Unfortunately, only 1 in every 5 adolescents are getting the recommended amount of physical activity. Increased rates of prediabetes in Hispanic adolescents is a health issue in dire need of solutions. For this reason, understanding the health topic of barriers and promoters of physical activity in Hispanic adolescents in Santa Maria must be investigated. As part of the literature review, studies were sectioned into 3 categories: intrapersonal, interpersonal, and environmental factors. A majority of studies utilize the social cognitive theory as a framework. Intrapersonal factors are those that are within the individual, such as beliefs, knowledge, and skills. Studies found when physical activity is perceived as fun and enjoyable, it is a promoter. Lack of fun and lack of motivation were seen as intrapersonal barriers to physical activity. Multiple studies shows that body image impacted adolescent engagements in physical activity. Body dissatisfaction was seen as a barrier to physical activity. A study revealed that self-efficacy was often noted as one of the best predictors of intentions to exercise, and additional studies supported this finding. Recent studies showed that competence, enjoyment, and improving physical appearance were strong promoters of physical activity. Interpersonal factors are those within social relationships, such as family, friends, peers, and can include cultural ideology. Numerous studies show that social support provided by parents and friends is a strong promoter of physical activity. Hispanic adolescents are often disproportionately faced with disparities in socioeconomic status and therefore display lower levels of physical activity due to increased adverse childhood experiences and less opportunities for physical activity, such as not being able to afford the high cost of sports. In terms of Hispanic cultural ideology, competing social interests such as time with friends, excessive homework, or family responsibilities leads to a perceived lack of time and was noted as a common barrier. Hispanics often view obesity as a sign of prosperity and would prefer a child to be chubby compared to being perceived as a malnourished, skinny child. Environmental factors are those within the physical environment and social settings. Studies found low socioeconomic neighborhoods that Hispanic populations reside in often lack appropriate infrastructure, were prone to unsafe areas of living and less access to parks, and communicated anxiety related to crimes as barriers to physical activity. On the other hand, studies showed schools that offer several opportunities to be physically active, such as physical education classes, after-school programs and activities, and exercise engaged during breaks promoted physical activity. For limitations and gaps, it was a challenge to find studies that included how sexual orientation in Hispanic adolescents impacts behaviors and physical activity. Historically, gender roles have often been a strong sociocultural correlate of physical activity among Hispanic culture. Therefore, it is important to acknowledge and include sexual orientation in research among Hispanic adolescents. In addition, perceptions of adolescents and their attitudes on adding in short intervals of physical activity periodically in a day must be explored to reveal potential strategies that aim to aid constraints of time noted in several studies. Perceptions of physical activity goals that focused on time management could also be helpful in investigating in Hispanic adolescents. Though literature exists that addresses socioeconomic status related to environment, how this factor impacts physical activity engagement in Hispanic adolescents, more research is needed to identify if increases in accessibility and costs can increase participation. The phenomenological design was selected for this study since the objective is to investigate the experiences of Hispanic adolescents regarding barriers and promoters of physical activity. The data collection process will begin with participant recruitment for a sample size of 7 Hispanic adolescents. Interested participants will then complete an eligibility questionnaire. Eligible participants will attend a first meeting and then a second meeting where a semi-structured one-on-one video recorded interview will take place. The constructs of the social cognitive theory, including observational learning, reinforcement, and self-efficacy, will guide interview questions. Typical of a qualitative study, The data analysis process will include the sequential steps of transcription, reading transcripts, coding, theme division, and interpreting results. Attesting validity and reliability is an integral and vital measure of a strong qualitative study research, and that establishes trustworthiness and credibility. The proposed study will triangulate data using member checking and peer debriefing to validate the study. Hiring a professional transcriptionist to transcribe the interview will also add validation, and audit trails and reflective journals will add to reliability. As far as limitations, purposive sampling and the small sample size will hinder the generalizability and transferability of the study. Reflective bias and misinterpretation bias may also be present. Poorly worded or misleading questions can also threaten the credibility of the study. Ethical considerations for this study include IRB certification and approval and use of parental consent forms. Thank you for watching this presentation. In the following slides, you can find the references.